also have tiny girl hands. My sterile glove size is 5.5, and I really need extra small gloves when I use gloves in the hospital. So I feel your pain. In most scenarios when you're learning back mask ventilation, they teach you the CE technique. CE technique, you're supposed to make a C with your fingers, and then the last 3 fingers, so middle finger, your ring finger, your pinky, form an E. The E is supposed to go on the jaw, and the C is supposed to go at the top of the mask. The problem is if you have a patient who's like not a child, like a full-size adult, especially if they're a man, it can be really hard to like really bridge this gap from here to here and hold a good seal on the opposite side. There are a few tricks you can do to make this happen. You could use counter pressure, or if you have like an anesthesia circuit, you can kind of use the weight of it. You can kind of like learn to stretch your fingers and counterweight differently, and that is what I did for a very long time. But there's a better way to do it, and that's really the OE approach. And then instead of thinking about like a C all the way at the periphery of the mask and an E down on the patient's jaw, think about having an O more at the top of the mask here, so we can have even distribution of the mask over the patient's face. And then we're gonna actually hold closer to the chin than to the angle of the mandible. So, traditional teaching, pull the angle of the mandible forward so that you're pulling the patient's face towards you, right? We're never trying to smush a mask down and do this, because that actually makes our obstruction worse. It makes it harder for the air to actually get from the patient's mouth into their lungs. We're supposed to be lifting their jaw towards us and then gently resting the mask and creating the seal. Instead, we focus on more of an O. We kind of like rotate our hand this way, and then we use our fingers to kind of lift from the chin itself. You can have the same exact effect. If the patient has a lot of extra soft tissue here, you can actually, I never want you to dig into the soft tissue and like push here, because again, that's gonna make your obstruction worse. But you can, kind of like delicately sometimes lift that soft tissue forward, and that actually can help relieve your obstruction as well. You should have a very, very low threshold to pop in an oral airway if you need help, or to ask for a friend and go to 2-hand technique. The 2-hand technique is gonna be a lot easier for most people. I take my ring fingers, I put it on the angle of the mandible back here, and then I use my thumbs like this to create counter pressure on the mask. This is gonna give you a lot more control, and again, you can phone a friend to squeeze the back.